Antioxidants. Vitamin A in the form of retinoic acid, which are the active forms. This is a fat-soluble vitamin, so it needs fat in order to be absorbed as well as transported throughout the bloodstream. It's needed for vision, cellular differentiation, growth, reproduction, bone development, and the immune system. Sources of this: milk and milk products, eggs, fortified foods like margarine and cereals, deep orange fruits, vegetables, dark greens, all are food sources of vitamin A. The claim here is that we can improve our antioxidant status and ameliorate some of the markers of oxidative stress that are induced by exercise. The evidence and the efficacy for this, currently there are mixed results, so we need more research in athletes in order to determine whether or not there's a real need for increased vitamin A to offset some of the oxidative stress produced by exercise. As far as the side effects of consuming vitamin A, if you have a pregnant female, then the fetus may actually suffer some teratogenic effects, that is, some improper development, simply from ingesting active form of vitamin A. So that's something that you want to work closely, or the athlete should work closely with their physician. Anorexia, which is a lack of appetite, not the eating disorder anorexia nervosa. So anorexia is just a lack of appetite, dry, itchy, flaky skin, alopecia. So there's hair loss, headaches, bone and muscle pain, conjunctivitis, so you get pink eye, and these are easily reversible except for the teratogenesis in the fetus. The application of this multivitamin is basically what's recommended, unless otherwise recommended by the general practitioner. Beta-carotene. The carotenoids are the phytochemicals that we find that have these orange colors and yellow colors and reds, and beta-carotene is a carotenoid. It's a type of carotenoid, so it's a phytochemical that we find in plants. The important part here is that it's a precursor to retinol or vitamin A, the active form of vitamin A. So you can take beta-carotene and basically convert it into retinol. Source of this: carrots, cantaloupe, broccoli, spinach, all nice sources of beta-carotene. Claim here is that it is a free radical quencher, that it'll enhance the immune system and induce detoxification enzymes and help with any detoxification that's necessary. This all spells a reduced risk for cancer as well as cardiovascular disease. The efficacy and evidence for this: there's supplementation after exercise that in some studies decrease lipid peroxidation. So taking lipids and oxidizing them because of free radicals that are hanging around, and damage from free radicals actually helps reduce that process. Reducing muscle damage, there's some evidence that beta-carotene helps with that. And there's also evidence to suggest that we increase the amount of glutathione, which is part of an antioxidant system within cells. Side effects here: high levels can result in some reversible skin color changes, so you may get somebody who has quite an off color to them, and that's absolutely reversible if you simply reduce the level of beta-carotene intake, so it's safe to consume. The application of this is about 6,000 micrograms per day. Vitamin C, also known as ascorbic acid. This is a water-soluble vitamin. It's needed for collagen synthesis, which is a protein. Collagen is a protein that allows things to be built upon it, like bone mineral density. You can increase the amount of minerals that you can pack into bone with the collagen structure in place. It also functions as an antioxidant. The source of this: citrus fruits, bell peppers, kiwi fruit, strawberries, broccoli, potatoes, tomatoes. The claim here is that as we increase exercise intensity, particularly strenuous exercise, then we're going to need more vitamin C to offset some of the free radical production that we see with that type of work. There also are claims of better heat tolerance. The evidence and efficacy for this: we know that after exercise, levels of vitamin C actually drop. So the idea is to increase these levels so that we don't get as much of a drop. We know that in some studies we see improved heat tolerance. There's actually reduced serum cortisol levels. So cortisol is, of course, a marker of stress. And if we have lower stress levels, perhaps it was due to the fact that we have more vitamin C that's preventing some of the, oxidative stress that we have from that intense exercise. We also have some studies that show us that it does protect against free radical production. So there seems to be something of value here with vitamin C and athletes. As far as side effects goes, consuming more than 3 grams per day can lead to diarrhea, kidney stones. You can upset the iron balance and absorb more iron with vitamin C in the diet. And for those individuals with hemochromatosis, this is a genetic disorder, you can actually cause some liver damage and even liver failure if they overconsume iron. You get false negative fecal occult tests. It also invalidates any urinalysis for glucose in the urine, which is not supposed to be there, but it is a test for diabetes. The application of this is about 500 milligrams per day. Vitamin E, which is in the form of tocols and tocotrienols. There are quite a few of these vitamin E variants. It's a fat-soluble vitamin, so again, it needs fat to be absorbed in the GI tract, and you also need some sort of transport protein to transport fat-soluble vitamins. It maintains the integrity and stability of cellular membrane, so that phospholipid bilayer, it's important as an antioxidant in that layer. Sources of this: plant foods, vegetable oil, salad dressings made with oil, nuts, seeds, leafy green vegetables, whole grains, and fortified cereals. The claim here is that it decreases the susceptibility of LDL to oxidation. So if you minimize that oxidation of LDL, then you're going to reduce the amount of free radical generation of LDL, which means then you can reduce your risk for cardiovascular disease because you have less plaque accumulation in the arteries. The evidence and efficacy of this: there's a good body of evidence that it does work as an anti-carcinogenic and anti-atherosclerotic agent. Side effects of this: greater than 800 milligrams per day causes diarrhea, flatulence, nausea, muscle weakness, and even fatigue. Greater than 1,000 international units, it actually may act as a weak blood thinner. The application of this, for about 400 to 1,000 international units per day. Selenium, which is an essential trace mineral, is part of this complex of glutathione peroxidase, or GPX, that works as an antioxidant system. The source of this: grains, meat, poultry, fish, garlic, and dairy. The claim here is that it is functioning as an antioxidant. However, the efficacy and evidence has not been conclusive as far as selenium being an antioxidant. Side effects: it is toxic at 900 to 100 micrograms per day, and the side effects include nausea, vomiting, depression, irritability, nervousness, skin rashes, and loss of hair and fingernails. Application about 100 to 200 micrograms per day. Zinc, another essential mineral here. It's a cofactor for over 300 metalloenzymes. These are enzymes that require some sort of mineral, usually zinc, copper, or iron. The source of this: seafood. Oysters are a great source of zinc, meat, fish, eggs, and poultry. The claim here is that we have enhanced immune function, that we can treat colds and shorten the duration of a cold, that it functions as an antioxidant, and we can enhance testosterone and sexual performance. The efficacy and evidence for this: we have improved biomarkers of immune function, and the duration of illness can be shortened by a day or two. However, in situations of diarrhea and URTI, or upper respiratory tract infections, it may also be an important player with those conditions. Side effects: none reported at the milligram dose. However, if you step up to the gram dose, then you might experience nausea, diarrhea, vomiting, and have interference with copper and iron absorption. The application of this is about 10 to 25 milligrams per day. Manganese. Manganese is another essential trace mineral. It's a component of the mitochondrial antioxidant superoxide dismutase. So you need to have manganese there, otherwise this enzyme cannot do its job, which is antioxidant protection. Sources of this: wheat bran, legumes, nuts, lettuce, seafood, poultry, meat, blueberries, and pineapple. The claim here is that we can decrease oxidative brain injury, reduce LDL oxidation, which would then, of course, decrease atherosclerosis. The efficacy and evidence for manganese as a supplement needs more research, particularly in athletes. Side effects: nothing reported. The application, again, nothing reported there as well. Copper. Another essential trace mineral here. It functions as an enzyme cofactor, and you need it for transferring electrons. It's also part of superoxide dismutase. Sources of this: liver, shellfish, whole grains, legumes, eggs, meats, and fish. Claim here is that it works as an antioxidant. The efficacy and evidence for this, we need more research. Side effects: it's a potential pro-oxidant. So there's a fine line between having too much and just enough before it becomes a pro-oxidant. It can also upset the iron and zinc balance if you overconsume copper. Application of this, none to report at this time. Iron. Another essential trace mineral. It's functioning as an enzyme cofactor. It's important in transferring electrons. It's also part of the antioxidant catalase. We also find it part of hemoglobin as the oxygen carrier. Sources of iron: meats, molasses, clams, oyster, nuts, legumes, seeds, green leafy vegetables, grains, and breads. Claim here is that it's functioning as an antioxidant. The efficacy and evidence for this, we need more research in these areas, particularly with athletes. The side effects here: it could become a pro-oxidant. Again, a fine line between overconsumption and just enough for our needs. The other issue here is that we can also upset the copper and zinc balance if you overconsume iron. So copper, zinc, and iron are all very closely tied in as far as their metabolic pathways are concerned, and if you overconsume one, you can upset the balance of the others. The application here, none to report at this moment in time. Polyunsaturated fatty acids, or PUFAs for short. These are types of lipids. They are unsaturated, so they contain more than one double bond. They are a part of cell membrane, so the phospholipid bilayer, and they include the omega-3 and omega-6 fatty acids, linoleic acid and eicosapentaenoic acid, and linoleic and arachidonic acids, respectively, for omega-3 and omega-6 fatty acids. Sources here for omega-3: nuts, seeds, canola oil, flaxseed oil, soybean oil, linseed oil, fatty cold fish like mackerel, salmon, bluefish, mullet, sablefish, menhaden, anchovies, herring, lake trout, sardines, tuna, and human milk. For omega-6, seeds, nuts, corn, sunflower, safflower, and soybean oils, and meats. The claim here is that we can increase performance. The efficacy and evidence at this time is inconclusive in the literature. For side effects, overconsumption may actually increase the susceptibility to oxidation because you're using up a whole bunch of vitamin E, which then reduces the protection of the PUFAs within the phospholipid bilayer. The application of this is not available at this moment in time, simply because we need more research. Monounsaturated fatty acids, or MUFAs. These are a type of lipid that have a degree of unsaturation. They have one double bond. The most common MUFA in the diet is going to be oleic acid. The source of this comes from olive oil, canola oil, and nuts. The claim here is that we can lower total cholesterol and lower LDL cholesterol, which reduces our risk for cardiovascular disease, and that we also reduce the susceptibility of LDL to oxidation, which again would reduce our risk for cardiovascular disease. The efficacy and evidence for this, it's very well documented throughout the decades. There's been a plethora of research in this area on MUFAs. The Mediterranean diet is rich in MUFAs, and that is certainly a diet that is recommended for a reduction in risk of cardiovascular disease. Side effects here, you can overconsume monounsaturated fatty acids and therefore overconsume kilocalories in general, which would lead to weight gain and then, of course, problems with increases in weight. Application of this, really none to report as far as athletes are concerned. Just introducing more of these in the diet. About 10% of total kcals is what typically is recommended, but those numbers do vary depending upon what organization you talk to. Conjugated linoleic acid, or CLA for short. This is an isomer of linoleic acid. It is C9C12 octadecus dianoic acid, as another way of saying it. The sources here: meat, dairy products, usually high in saturated fat foods. It supplements usually use the vegetable oil sources. The claim here is that you can get some weight loss out of it, increase muscle hypertrophy, increase cardiovascular endurance, and it's an adaptogen, so it helps you adapt to stress, and it may reduce your risk for cancer. Efficacy and evidence for this: there's some evidence to suggest that it might give some fat loss adaptations in moderately overweight adults. The side effects of this is that it may increase insulin resistance or even promote oxidative stress. So we're not sure. We need more research in this area. The application of this, about 3 to 6 grams per day for 4 to 12 weeks. Coenzyme Q10, or ubiquinone. This is a substance that exists in the mitochondria of skeletal and myocardial tissues as part of the electron transport chain. It functions there to transfer electrons. It has antioxidant properties as well. The source of this are animal products, and a few plants do also contain this. Claim here is that we can increase vigor, increase energy production from the electron transport chain, and decrease oxidative damage from exercise. The efficacy and evidence: there is currently no supporting evidence for increases in performance, and it actually may in fact be ergolytic. That is, it may decrease performance if you overconsume it. There is some good evidence that it does function as an antioxidant, so we can reduce our risk for cardiovascular disease and cancer using this substance. Side effects of this: we can increase oxidative damage from high-intensity exercise, and this is known from increases in plasma CK as well as malondialdehyde. Other side effects: gastric distress has been reported, heartburn, nausea, stomachache. Application of this 50 to 100 milligrams per day. In patients with myocardial ischemia, it actually did improve exercise capacity. Alpha lipoic acid, or ALA. This is a sulfur-containing fatty acid. It is present in mitochondrial proteins as a cofactor. Source of this: we're not sure if we're getting this from the diet or whether it's endogenously produced. So the jury's still out on that one. The claim here is that it is an antioxidant. It scavenges for the HO2, HOCl, and O2 free radicals. It helps regulate blood glucose in diabetic patients. Efficacy and evidence: there's evidence to suggest that it does reduce oxidative stress, and it does reduce LDL oxidation, which would theoretically reduce our risk for cardiovascular disease. However, we need more research in this area. Side effects: none reported. The application of this as an antioxidant, 50 to 100 milligrams per day, and for reducing blood glucose or regulating blood glucose in diabetic patients, 300 to 600 milligrams per day is what's recommended. Polyphenols, which are found in a variety of plant substances, so this is not an all-inclusive list here. They function as antioxidants. They donate electrons to stabilize these free radicals, so they're less damaging to surrounding cells. Source of this: any plant sources are going to have some form of phytochemicals or polyphenols. The claim here is that it is functioning as an antioxidant, that we can reduce our cardiovascular disease and cancer risk. Efficacy and evidence: study really depends on what molecule you're looking at, what substance you're looking at. So it's kind of hard to lump all of these together, but as a general rule of thumb, consuming polyphenols seems to protect us against free radical production. Side effects of this, again, is going to depend on the substance and the extract that's used in the supplement. Application, again, is going to be variable.